Good morning, everyone. Welcome to Saddleback Eye Center's LASIK seminar. My name is Lori, and I'm a patient counselor here at Saddleback Eye Center. This morning, we'll be going over the LASIK procedure, as well as some frequently asked questions. Next, I'd like to introduce you to Dr. Manger. Dr. Manger founded Saddleback Eye Center and is our LASIK surgeon. Dr. Manger attended the U.S. Naval Academy with the degrees in math and nuclear science. He then went on to serve as an officer on nuclear submarines in the U.S. Navy. After the Navy, he continued on to medical school at USC. After USC, Dr. Manger did his internship and residency at the renowned Doheny Eye Institute and is a board-certified ophthalmologist. Dr. Manger is considered to be the most experienced LASIK surgeon on the West Coast, having personally performed over 75,000 LASIK procedures over the course of the past 18 years. He is the only LASIK expert in California with one office location and one specialty, LASIK only. Our practice is 100% committed to LASIK, and this is all Dr. Manger does 5 days a week, 50 weeks a year for the past 18 years. Dr. Manger routinely performs 200 to 300 LASIK procedures each and every month and is considered to be a leading authority in the world for LASIK. So trust me when I say you are in very good hands with Dr. Manger. So now, before we begin asking our panel questions, I'd like to bring up Sandy. She had LASIK on October 20th of this past year. Before LASIK, her vision was 20/40, and she's now 20/20.
Thank you, Dr. Manger. It was instant recovery. It has, the best way to tell you how I feel is I am in love with my eyes. I can't tell you. I can see. I don't have to like squint. I can focus. I can see there, here, everywhere. It just is amazing. It will change your life. If you're on the fence, if you're waiting, that's not true. That's just don't wait. There's no reason to wait. This is a gift you will give yourself. No one's going to tell you how it's going to feel like. It's just amazing. Give yourself the gift of perfect vision, and then it'll be your aha moment. And on behalf of my family, which I think it's 13 of us that have had our LASIK done here with Dr. Manger, thank you so much.
Thanks.
He is truly a craft. This is his craft. This is his art. Don't waste your time. Just do it.
Hi, good morning. My name is Vanessa, and I'm the Director of Marketing at Saddleback Eye Center. And this morning, I'll be asking the panel a series of questions about LASIK, and I'll also be going over the 3 biggest mistakes that people make when choosing a LASIK surgeon. I myself have had LASIK as well as amongst many of our staff members and our family members here. So we certainly understand the questions that might be on your mind about LASIK. So today we're going to give you as much information as possible to make you feel more comfortable with the LASIK procedure.
Before I talk about LASIK, let me explain about the eyeball, how it works first. It's like a camera. There are 2 lenses in the front. Both of them focus the picture onto the film in the back. This is what we call the retina. So the nerve along here pick up the image and send to the brain. That's how we can see. The outside lens control your distant vision. The inside zooming lens control the reading up close. So we will talk about the outside lens first, how we control your distant vision. Now, if you think of that outside lens is like a glass dome over your watch, if it's stiffen up like this, then you see a lot closer, bigger, then you are nearsighted. If the glass dome is too flat, then it focuses way out there, then you are farsighted. If the glass dome is not round, but it's more oval shape, then everything looks distorted. That's called astigmatism. So the shape of that dome determines how you see. LASIK correct that dome for you. If it's too steep, we make it flat. If it's too flat, we make it steep. If it's oval, we make it round to the perfect shape. How do we do that? We actually go through 3 lasers here. That's why it's called all laser LASIK. The first laser will map your eyes. The second laser create a little skin flap. We lift the skin flap, use a third laser, shape the eye, and then put the flap back down. Dr. Manger will go over each of the laser for you and the detail and the technology that we have in there. Okay.
Now, Dr. Manger, my next question is going to be for you about the technologies. You said over the years there are 3 major advancements in technology. The first being the custom view or wavefront technology, the second being the interlaced laser to replace that metal blade, and the third being the eye tracker. So can we break these down individually, starting with what is the advantage of the custom view laser over the older way we used to do LASIK?
Okay, first to discuss the custom view laser, let's start off with the way that I first started doing LASIK in 1996. We didn't have the custom view laser. We relied mainly on the 4-opter numbers. Your when you go into the eye doctor, they figure out your contact lens prescription or your glasses prescription using the 4-opter on the left there. We did that test and relied on those numbers primarily because those were the main measurement numbers we had. We would make all sorts of adjustments based on a lot of things about the patient, so we had to modify those numbers, but the starting point was the 4-opter numbers. So that's the way we did it from 1996 through 2002. In 2002, we had the custom view laser introduced, and that's what we call wavefront technology. And that is a laser that actually measures your eye, and it's going to measure the nearsighted, the farsighted, the astigmatism super accurately and objectively, and it measures a lot of other things about your entire visual system that heretofore we haven't been able to measure about the eyes. There's so much information that it measures in that 5 minutes that you're in front of it to measure your eyes, that if we printed out all that information, there's 45 pages of information. So that's a lot of information for which the surgeon to look at that information, analyze it, and customize the treatment of your eyes based on that. And that's why experience is a huge thing when it comes to doing LASIK and getting a patient the very best vision. Now, the intralaser laser is another topic that we need to cover here, and the intralaser laser was actually introduced in 2001. Now, before 2001, when I did LASIK procedure starting in 1996, we used the metal blade, and we had the procedure master. We could do a good job on it, but I'll tell you that once or twice a year that there was a cap that wasn't a perfect round, perfect cap that we wanted, okay? And this is a picture of that, the microkeratome and the metal blade, and that's what we used to use. And now there's, with the computer and with the intralaser laser, we're able to get more accurate caps, and it's a much safer procedure, and I really consider it the biggest development in the field of LASIK since I've been doing it the last 18 years. 20 to 30% of all the LASIK surgeries that are done in the United States this year will still be done with the metal blade. And the reason is because there are a lot of ophthalmologists, and we'll cover this later, who only do 4 or 5 a month. They only do 4 or 5 LASIK a month. They don't really do enough to support having a laser in their office, and they can get the job done pretty well with a metal blade. But honestly, pretty well doesn't do it here. I want to be able to do it technically correct every single time, and I want to make that flap very accurately. And we're now on our 5th generation of intralaser laser. They've fine-tuned it and made it a little better each and every generation, and we've always been one of the first ones in the world to get their newest generation laser. As I say, we have our 5th generation laser now, and it's very rare, but we're one of the few places, very few places in the United States that actually has 2 of those lasers, just because of our commitment to LASIK.
And the other advancement in technology that patients really like is the eye tracker. Dr. Manger has eye trackers on every single one of his lasers that are tracking the motion of your eye's movement 1,000 times per second. So a comment that we hear patients say quite often is they say, well, I definitely trust Dr. Manger. I know he's done LASIK 75,000 times here, but what if I do something? You know, what if I move or look away during the procedure? Am I going to mess it up somehow? Well, not to worry, that's what the eye tracker is there for. So even if you did move in the very slightest, you don't have to worry. So, but that really leads me to the first mistake that people make when choosing a LASIK surgeon. And that mistake is thinking that the technology is more important than the surgeon. There are 24 different decisions that Dr. Manger has to make on every single eye before he operates. The laser doesn't tell Dr. Manger what to do. Dr. Manger is telling the laser what to do. So that's why the procedure will only be as good as the surgeon that you choose. So Dr. Nguyen, now that we're comfortable with the technology, how do I know if I'm actually a good candidate?
We're looking for the main three things that when you come in for the exam. Number one, you're 18 years old, because that's when your eyeball grow to a full adult size. Number two is your prescription stable for 1 year. And we're talking about if it's small fluctuation, 0.25, 0.5, that makes no difference. So that would consider to be stable. Number three is that the eyes are healthy. There's no eye disease inside, like cataract, any severe glaucoma, any keratoconus, any condition that can interfere the result. So when you come in, we actually conduct an exam. It takes about 2.5 hours long, because we do 14 tests, and all of these tests will be done to check everything inside out, making sure that you're a candidate for it.
So Dr. Manger, one of the biggest myths that we hear in LASIK is that people have been told they're not candidates for LASIK because they're farsighted, or they have astigmatism, or they just wear reading glasses.
Yeah, when patients come in this office on a typical week, 20% of the patients are not going to be good candidates for LASIK, and we tell them that. And usually it's because they're losing their vision, and they've had a big change in vision, and they're older, and they have cataracts. They have advanced cataracts, and they're just not good candidates if they have advanced cataracts. Or for the younger people, some of the younger people, unbeknownst to them, have a weakness of the cornea called keratoconus, and they're not good candidates. And then really, there are dozens of different reasons why somebody might not be a good candidate for LASIK. So that's 20% of our patients. But that means 80% of our patients, I do tell, yes, you're a good candidate for LASIK. But what is amazing is over half of that 80% has been told sometime within the last 10 to 15 years that they're not a good candidate for LASIK surgery. So you say, well, that's terribly confusing to the patient to be told two different things like that. So why does that happen? Well, the reason it happens is simply most eye doctors out there are not doing LASIK surgery. Certainly all the optometrists and some of the ophthalmologists don't do LASIK surgery, and they're not going to be supportive of it. And they're going to casually throw out, well, LASIK doesn't accurately correct farsighted people. Or LASIK does, you might as well just wear the small reading glasses. They still don't have a good solution for the reading glass problem. And as Vanessa pointed out, I've corrected my own son's farsightedness 15 years ago. My wife needed reading glasses, and actually my daughter had astigmatism, and I corrected that. So these are things that we're comfortable with, and if you don't have one of those eye conditions that exclude 20% of our patients, then you're going to be one of that 80% that's a good candidate for LASIK.
So that leads me to the second mistake to avoid in choosing a LASIK surgeon, and that is going to a LASIK surgeon but not a LASIK expert. LASIK surgeons really fall into three different categories. The first category is that of the general ophthalmologist, and actually 98% of LASIK surgeons fall into this category. And this surgeon is usually the patient's longtime ophthalmologist who they've gone to for years for glasses or contacts or routine eye exams. They do multiple procedures like cataract surgeries, eyelid surgeries, and they only do usually between 4 to 5 LASIK procedures a month. The second category of LASIK surgeons is that of the retail LASIK centers. And these are the places that have multiple offices, so the surgeon's going from office to office, or they have multiple surgeons, so you never really know who you're going to get. And they mainly exist by offering LASIK at a reduced price. But what they don't tell people is that they're cutting a lot of corners on technology and patient care in order to reduce the price. So the main problem with these places is that because they have so many locations, their staff and their office and their technology and their equipment is spread so thin between office to office that they can't do a necessary LASIK exam. And these are the places where you usually don't meet the surgeon until the day of the surgery. That really just brings me to the third category, which is very rare in the United States, and that is the category of the LASIK expert. which I know it's hard to believe, but there's over 500 LASIK surgeons just in Southern California. And out of those 500 surgeons, Dr. Manger's the only one who does LASIK 5 days a week, 50 weeks a year. His practice is 100% committed to LASIK. Half of Dr. Manger's staff have worked here with him for over 20 years. So there's not another LASIK facility in California with as much educated staff as Dr. Manger's. And Dr. Manger personally has performed every single one of the 75,000 LASIK procedures here at Saddleback Eye Center. I know a lot of patients come in here and then they say, well, who's going to do my surgery? Dr. Manger is. He does every single procedure. He will do your procedure as well. So my next question is going to be for Dr. Nguyen. Can you explain to everyone what to expect the day of the procedure and how simple Dr. Manger makes it for them?
Okay. Once you are a candidate for LASIK and then you're ready for the procedure, on that day when you come in, most of the people will get nervous because when they read the consent form, they start to get nervous there. And the reason we get nervous or afraid because we have the fear of the unknown. And exactly why Dr. Manger trained all the staff to coach the patients. So if you know what is the next step, then you're no longer nervous or afraid of it. So when you come in, we don't use blade, there's no needle, all we use just eye drop and laser light. So that's already take away a lot of fear from patients. When you come in, you will lie down looking up, Dr. Manger arranged the equipment, the coach will tell you, detail, Dr. Manger cover the right eye now, we're going to work on your left eye, they count out the laser time just like our speaker told you. Once you're done, they will bring you out. We will check the eye, make sure everything looks perfect, and then you get to go home right away. Now, when you get home, all we ask is rest, take it easy. You can actually watch TV later that night, but no strenuous activity, no extreme reading, anything like that, because we don't want the eye to get dry out. So after a good night's sleep, patient come back next day, and we check their eye, they can go back to work. Majority people actually go back to work the next day. They don't have to take time off from vacation, sick time, just to have LASIK done.
So there are just a few restrictions after the procedure. There's no swimming for 2 weeks. If you want to swim in the second week, we just ask that you wear waterproof goggles so you don't get water splashed in your eyes. No heavy weightlifting for 3 days after the procedure. So just don't lift anything extremely heavy. Typically we say over 100 pounds or more that would make you really squeeze or squint your eyes. Probably one of the hardest restrictions is for the ladies, just no eye makeup for 3 days after LASIK. So just no eyeliner, mascara, or eyeshadow. And then we have all of our patients protect their eyes for the first 5 days and 5 nights with clear lens glasses during the daytime and then goggles at nighttime for the first 5 nights. So it's pretty easy. Dr. Nguyen, if I'm over 40, can Dr. Manger correct my vision so I don't have to wear reading glasses?
Yes, that's the second lens that I was talking about. So far we talk about the outside lens for distance. So the inside lens is the zoom lens in the camera. This lens is supposed to be clear and soft and flexible, so the muscle can put them in or let them go. That's how we can zoom 2 eye to see here and 2 eye to see there, and everything works well for 40 years. After 40, things seem to be moving out further and further until your arm's not long enough and you get reading glasses. This is called presbyopia, and it happens in everybody. Some sooner, some later, but there is no exceptions. Up to date, there is no procedure that can perfectly correct that lens to create the zooming effect again. So what Dr. Manger offers here is called blended monovision. In regular LASIK, in younger patients, we correct both eyes for distance, and their lens just zoom and they can read. In blended monovision is applicable to most of the patients older than 45, where we make one eye for far and one eye for the mid-range, so that way the picture can blend together. And this is how people can see far and near without glasses most of the time. How do we know if you are a candidate or not? When you come in for the exam, we actually measure your eye prescription first. We actually show you what it would be like, and then we will help you determine whether you're a good candidate for that or not. This is very personal choice. It's not something that your neighbor had it, didn't like it, then you don't like it. It's not something that because your husband had it, so you have to have it. It's your eyes. It's what you expect, so we would have to show you. We customize the prescription to present the blended monovision for you.
And I myself, by the way, I've had monovision for many years. I had the eye surgery many years ago, and I have monovision. I can see great in the distance. I can read just fine. I can see through the operating microscope. It's just amazing.
Let's talk about price. So what advice would you give to patients who are concerned about the cost of LASIK?
They interviewed thousands and thousands of patients that had surgery at budget centers, and they found out 1 out of every 6 patients was very unhappy with their vision. And that is very unacceptable. Like I said earlier, we're confident we're going to get you good vision, but that's an amazing statistic. 5 or 6 times every month, I have people that come in for a LASIK exam, and they've already had LASIK at a budget center, and half the time I can help them, half the time I can't. LASIK surgery done with a budget mindset, where the surgeon is cutting a lot of corners to make sure they keep it at a low price so they can keep people coming in the door. You want the surgery done right the first time.
So the best way to find out if you're a good candidate is to come in for a LASIK exam. Remember, it's a 2 to 2.5 hour exam, and Dr. Menger will personally evaluate your vision during the exam. If you wear soft contacts, if you could please be out of those 2 days prior to your exam and procedure if possible. But if you wear hard contact lenses, if you could be out of those for 2 weeks prior to your exam and procedure. Many of our patients like to have their procedure done on the same day, simply because it's more convenient for them to only have to be out of their contacts at one time. So if that's an option you're interested in, just let us know. We are happy to make arrangements for you. You do need to have a ride home after your procedure, but if that's a problem for you, or if you live out of the local area, just let us know and we can arrange a complimentary hotel stay for you the evening of your procedure at the Courtyard Marriott, as well as provide transportation to and from the hotel for you. And we do see you back here the next morning for a quick post-op checkup, and then you can return to your normal activities the next day. Our fees for LASIK are all inclusive. They cover your surgery fee, facility fee, all post-op care for 1 year, all antibiotic drops, and any necessary enhancement. I'd like to thank our panel, Dr. Nguyen and Dr. Menger, as well as all of you for coming this morning, and we hope to see you in our office soon.